If you want to know why you dey feel the way they feel inside your mind, inside your brain, and generally why things dey the way they around you, Mind Clinic na the radio program we go teach you how to deal with all different types of stress and other things wey person dey go through. On top Mind Clinic, you fit talk about mind matter wey concern you directly or the one wey no even concern you directly.
Mind Clinic is brought to you proudly by Neem Foundation. My name is Victor Purple. I've got the ever amazing Chinyerugo Udensi. Good morning.
Morning, Victor.
Thank you very much for getting to the show at this time. Always very interesting having you on the show every Wednesday morning. So we started out talking about something very interesting last week on the show. And this week, we'll be looking at religion as it concerns mental health. We'll be speaking to a therapist, a transitional and transformational coach, Mr. Tunji Babajide. Good morning.
Yeah, good morning, Victor. How are you this morning?
I'm very well. Happy birthday.
Thank you once again.
All right. So, Abuja, we hope that when we throw the phone lines open, our listeners can call in just to say happy birthday to the guest at least, and then perhaps ask questions.
All right, not a problem at all.
All right, then. So, Chinyerugo.
Yeah, so, the bulk of the conversation today will be looking at religion and mental health. And I thought it was quite interesting that we talk about it because there's a lot of misconceptions and idea around it. We need to start getting people to think about it differently or, just to begin a conversation around it and correct some misconceptions about it. So who best to talk to them, Mr. Tunji, and just give us some insight on the topic. So I guess we'll start with talking about, the impact of religion on mental health. A lot of people, have these misconceptions that most mental health challenges are as a result of maybe like a punishment or a curse or you have done something wrong. That's why you have a mental health challenge. That's what a lot of people think. I know some of the misconceptions we'll talk about. But I wanted to just help us, let's start with what's the impact of religion on mental health?
Okay, thank you so much. So let me start by saying that mental health is about mental wellness. We all have mental health. However, mental illness is when someone is diagnosed with mental disorder.
Yeah.
Okay, so it's a dichotomy. There's a positive impact of religion on mental health, and there's also the negative impact of religion on mental health. Let me start with the negative. The negative impact on mental health starts from isolation at different stages of, religious gatherings. Some religions say women stay here, men stay here. And also some of the things that are being taught. Stress is a normal thing to the human mind. Yeah. There is what we psychologists call self-imposed stressors. For example, when we begin to make prayers that we don't have the capacity to carry out, so some of those things, some of those prayer, sometimes I see some prayer meetings on TV, on radio, and I'm like, this is going to be a strain on the mental health of the person or the people praying this because it's not holistic, it's too particularistic, it's too distant, it's too, I'm trying to find the right word. In other words, so that's one part of the negative effect. Another part of it is when pastors, imams begin to become a general practitioner, where they can't draw boundaries between spiritual help and psychological help. So, there's a lot of stigmatization for we therapists and all of that because people think that when you are a psychotherapist or a therapist, you only attend to mad people. No, that's not true. Because mental health is a continuum, it's a spectrum. It ranges from having a good mental health to having a mental disorder. So a person will vary along this continuum at different points of his or her life. So you can't say I have mental health on the 1st of January 2020 and you have it. There are things that impact your mind that can cause certain interferences. For example, I had a client last year, they had taken her to different churches, and they were, pouring water, doing all of that. By the time she got to see me, She was just a few inches away from hallucination. However, if they had done the right diagnosis, they would have gotten the right prescription. And I like to say this, that part of the impact of religion on mental health is sometimes it is wrongly diagnosed. And you see, just like when you go to the hospital and you are wrongly diagnosed for what you don't have, they will give you a wrong prescription. So some people think that mental health issues or mental illness, the spiritual problems, not all of them, very minute of them are spiritual. Okay? However, all of the people who are saying, I don't want to see a therapist and all of that, this is the question I ask them. When you have illness in your body, you see a doctor, right? Yeah. When you have spiritual problem, you see a pastor. When you have problem with your soul, who do you see? Is a therapist. So I don't get it when people say, I'm comfortable to see a doctor and I'm not comfortable to see a therapist. It's just a huge stigmatization in the society, and I think it's largely based on religion, our culture, and the fact that the African mind likes to mystify what he doesn't understand. Yeah. Okay, so that's the negative impact. The positive impact is that research has it that religion has a therapeutic effect on mental health. Okay, it helps people develop coping mechanisms to the impact of mental health on the mind. For example, I personally have a client who had gone through therapy. Then she walked into a worship experience by a very popular worship leader. And, she came out, she kept improving, because one of the things we do as therapists is to study and to find out improvement. So when I saw her by the next person, I said, so what happened? She said, that so person has a contract, so I went there, and I was like, I snapped out of it. So there's also that part of it. Also because religion has a very healthy, or could have a healthy support system, that also cannot be brushed away. So yeah, it's a dichotomy, like I said. It has the spiritual impact, the negative impact, and it also has the positive impact. However, there's an intersection of mental health and spiritual health.
Yeah, I'm glad you mentioned that. In part of the conversation, in part of the feedback or response you gave right now, you mentioned one or two misconceptions people have related to religion and mental health. I wonder if you could just touch a bit more on other misconceptions that people may have. I know you mentioned the first one, that we always think that we can't receive therapy, but we better go to a doctor, and then you keep on wondering when there's need for you to attend to your soul or your mind, who do you go to? What other misconceptions do people have about religion and mental health?
Okay, so I just mentioned about 3-4 more. Okay, so another misconception people have about mental health is some people think that mental health disorders are signs of weakness or personality flaws. That's not true. Some people go as far as ignorantly saying things like, if someone wants to be happy, they can be happy. If you ignore the problem, you can use willpower, the problem will simply go away. No, people don't. Not everyone snaps out of mental illness. You need to see a therapist to come out of it. Another misconception is people say things like people with mental health disorders are violent. Not everyone. Okay. One of the signs of mental illness is people who hoot unnecessarily in traffic. By the time you begin to shake the table, you realize that there are people in Thai who have mental illness. There are people in Thai who look good, very lovely makeup, pancakes, foundation, pillars, everything on their face, look good. But the issues, they're not discussing. So good looks, some people also think that you need to look scuffled to think you have mental health. No, there are people with very good looks who have mental health disorders. The third misconception is people say things like healthy people aren't affected by traumatic events. Some of that people say ignorant people or they say it's because they really do have a mental problem. That's why blah blah blah. So it's not. Let me put it this way: it's not the absence of a smile or the presence of a cry that determines who has mental health. Like I said earlier, it's a continuum. So people saying, because so things happen, is a sign. No, it's just a total misconception. Another one misconception that is very, very common is that people say things like depression can be cured by prayer. Depression can't be cured by prayer alone. Even if there's going to be a combination, it's going to be like a support system in the process of the recovery. Okay, another misconception is that some people think that mental health issues shows up when people begin to hallucinate. No. So you have seen people working into my office look very good, smell good. But by the time I got their briefs, I realized that there was a whole lot of cognitive distortions that they're dealing with. They're clueless, hopeless. They've attempted suicide a few times. They have a lot of other disorders, eating disorder, and all of that. So to mention a few, those are some of the very popular misconceptions about mental health.
Yeah, I totally agree with what you've said, that some of these misconceptions add to they add to the negative information that people have, and then limit people's ability to seek help because they feel like these misconceptions are the reality when these things are not true. And I'm glad that in the early conversation we had, you actually talked about the positive impact of religion on mental health, or let's say the positive impact of religion on mental health challenges. Mental health are mental health challenges, because sometimes we find that we try to separate those worlds, and we don't really realize that there could be a meeting point, and there's also like a separation point, And it just comes down to the next conversation I want us to have about, can religion and mental health exist simultaneously, and how can they exist? Maybe you can just expand a little bit more on that.
Okay, yes, they can exist together simultaneously. You see, because like I said earlier, there is the beauty of having an holistic approach to mental health starts from seeing it from two perspectives. Starts from the mental health and from the spiritual health. Okay, and when I say spiritual health, I'm not saying the number of hours you spend in church or in the mosque. I'm saying, for me, spirituality is the connection to your highest and deepest self. Okay? However, church mosque can trigger it, but there's always that, that drift between religiosity and spirituality. A lot of people that think they're spiritual are actually religious. Okay, because spirituality starts when you do four things. When you're spiritual, four things you should. Number one, you have self-awareness. Number two, you have self-acceptance. That's when you can give praise to God. There's gratitude. Your life unlocks gratitude at certain heights, at certain levels where sometimes it does not, align and, aligned with your physical state. For example, who starts to give God thanks after losing a husband? Who starts to give God thanks after an accident? So it's self-acceptance. So you accept yourself in spite and despite. In spite your job, despite your lack of job. You begin to accept yourself with a spouse, without a spouse. You begin to accept yourself with money in your bank account and with no money in your bank account. That's a level of spirituality. So a lot of people needs to unlock that part of themselves to have that consistent capacity or skill, permission to use the word skill, to snap out of their reality and begin to see things from a new perspective. Okay, the third one is there's that consciousness that you want to have service to humanity and to God. Okay. And the fourth one is self-care. You see, one of the signs that mental health challenges begin to take a toll on the client is they begin to do less of self-care. So I'm presently doing research with a school in the US, and we're looking at coming up with what we call a psycho-spiritual approach to mental health challenges. We realize that since there's an intersection between mental health and spiritual health, we're looking at approaching it as therapists and psychotherapists from an holistic perspective where once the values of the person you're seeing or the group therapy you're having connect with certain spiritual understanding, it can be used as a support system. In fact, research has shown that religious beliefs and religious practices are supportive to cope with stress in life and are beneficial to mental health. I mean, you can find all of that online. We also found from our research that lots of interest in religious activities is a common symptom of depression. When we have 10 people who have depression, we realize that the people, majority of them, about 8 or 9 out of the 10, they usually would have a lot of interest in religious activities. Okay, so spirituality is essential for psychiatric practice to be effective. That's one of the things we found out in our research. Okay, so it's important to know how to draw the balance, especially when you meet a certified, I'm not talking about everyone calling themselves a life coach and therapist, I'm talking about certified life coaches and therapists. There's always that capacity to draw the boundary. So but for someone like me, I've got some level of responsibility in my faith. So I'm a certified counselor, I'm a certified therapist. I realize that I see my patients from an holistic perspective. Okay, being able to diagnose, hear what they're saying and hear what they're not saying, being able to be intuitive enough to connect with people and take them on that journey of recovery. So it's an interesting thing. It's just very sad that our government is not paying enough attention to mental health in this part of the world. There's a lot of opinions that COVID-19 has been able to bring into the pulse of government. I can't find, that space, I can't find anything in that space. But you see, pretty much there is a noiseless effect of COVID-19 on this nation. If there's anything that government needs to begin to do now, I recommend that they begin to create therapy hubs where people can recover from. There's a lot of noise there. People, 230 cases today, 450 cases today. That's the noise. Yeah. But there's a noiseless effect of COVID-19, and you see, we're just starting, where there's going to be a lot more suicide, there's going to be a lot more depression, there's going to be a lot more people that will be paranoid. If we find anyone in government who is willing to explore these options, CSR from organizations, it's time for us to begin to deal with this mental health challenges that will ravage our society. It will almost become an epidemic.
Right.
The two can come together, and it's important to have that in this conversation.
We need to take a break. When we come back, right, we would like to look at some other aspects of this conversation. Quite an interesting conversation, I must say. In part 2, after the break, we'll find out if a religious individual can experience mental health challenge. We've realized a lot of people shy from conversations regarding mental health, but I dare say that mental health disorders are not uncommon, and the global burden of mental health disorders is projected to reach 15% by this year 2020, and by this time it will be estimated that common mental health disorders such as depression, anxiety, substance abuse will disable more people than complications arising from AIDS, heart disease, accidents, and wars all combined. And this is an astonishing statistics. It has posed serious questions as to why mental health disorders are not given so much attention. In Nigeria alone, it is estimated 20 to 30% of our population are believed to suffer from mental health disorder. And it's a very significant number considering an estimated population of over 200 million. If you do the maths, it's about 40 million and 60 million. Quite interesting. But on the show this morning, we're tying religion to the issues of mental health. Chiarugo.
Yes, I'm here with you.
All right, please, let's have our guest and then we continue with part 2 of the conversation. Bamidele. Hello?
We're back on.
All right. Babajide, yes, Mr. Babajide.
Yes, sir.
So we're talking about religious individuals experiencing a mental health challenge. Is it possible? Can a religious individual experience a mental health challenge?
Yes, it's very possible. It's just like asking, is it possible for someone who is spiritual to have COVID-19 or to have malaria? Yeah, it's very possible. So spirituality does not bulletproof you from mental health. Okay, it can reduce the impact because of the social support, because of the hope that is being reignited from sermons and all of that, from people groups, but it's not an immunity against mental health. People who are religious, people who are not religious, they face the same challenge when it comes to mental health challenges.
All right.
Yeah. And, with the whole conversation we had been talking about mental health and spirituality or religion, we realized that usually when people have challenges, the first call of action, other than the hospital, is to call the religious leader.
Very true.
Religious leader. And I'm thinking we need to start having conversations about mental health practitioners and religious leaders having a form of dialogue where both parties come together and we understand the role that we play in the health, the mental well-being of Nigerians, seeing that it's easier for them to access the churches quicker or the religious centers quicker. And perhaps there needs to be that conversation where religious leaders work together with mental health practitioners and where everybody understands the boundaries and the role that they play, and that we don't over-exaggerate our capacity. Because I totally agree with you that a lot of the times people go into these centers and they are not treated appropriately. Maybe they put in chains, or they're given maybe some form of maybe water or something to drink that they're going to feel better. And we know that these things don't work, because even when people experience a mental health challenge, they do have moments of, moments that we can say, oh, they are okay. But that when the challenge still comes back again, it could be worse, because you have not dealt with something. You haven't addressed the problem from its root cause. And that's why I'm actually glad we're having this conversation.
Yeah, I totally agree with you. We need that collaboration between spiritual leaders or religious leaders and the mental health practitioners, the value chain of the mental health practitioners, from psychiatric doctors to psychotherapists to therapists, and at some point of training to certified life coaches. Because you see, this is sad, but it's the reality. I was invited to speak to about 400 pastors, sometimes in 2018, on the awareness of mental health. And my phone number was on the screen, my email address was there. I mean, by the time I started getting emails, people were laughing back at me that I'm a new age person, that they can never bring me to their church, blah, 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 blah. And it stems from a lot of lack of understanding, lack of collaboration, insecurity, our culture. Because the male gender also sometimes feels that seeking for help is a sign of weakness. And I need to also mention that, for women who have mental health challenges, I mean, they're quick to want to, find help. But for men who have mental health challenges, I don't know where we got this narrative that men don't cry. Men feel that seeking for help is a sign of weakness. And it's not true, because for mental health challenges, the earlier you come to see or to seek therapist or psychotherapist, the better for you. Because early treatment guarantees quick snap-outs, quick recovery, than when you've gone round and round and round, and you are now coming to the last option. So I think that that hope needs to exist. I don't know who's listening this morning who can make that happen, but we need to have this conversation. We need to make pastors, imams know that we are not certified to take people to even ability to even diagnose. That's why I've been an advocate for therapy hubs in churches, therapy hubs in mosques, therapy hubs in communities, where there are basic, there's what we call the mental health first aid, what we can teach mental health first aid, especially because we're in a very judgmental society. People don't feel comfortable being vulnerable to everyone or to some people. So I'll just probably run through that, then we can continue. So the mental health first aid is set up to have a well-developed action plans on how individuals facing the mental health challenge can both help themselves and be helped by first aiders. Just the same way we have first aid box in schools and in organizations, there's also the mental health first aid. So we call it the ALGEE. A stands for be able to look and access for risk of suicide or harm. L stands for listen non-judgmentally. G stands for reassurance and information. E stands for encourage appropriate professional help. Then the last E stands for encourage self-help, self-care, and other support strategies. I mean, so mental health first aid encourages self-help, not self-medication. So that's one of the things that we teach to the religious organizations, to HR managers, to say, what are the first few things? What are the signs I need to see? How do I make people get vulnerable in their conversation to say, these are the issues I have? So all of these things, I think, they're locked up in our employee support program. that I think that a lot of organizations or churches are not warming up to. And I'm I know I'm on air, and every statement I'm saying is out of data. Nigeria, the world and as a whole, is about to experience an epidemic in the area of mental health. In fact, WHO said that by 2025, that mental health related issues will be the highest killer of human beings, not HIV, not COVID, nothing. It will be the highest. Why? Because now that COVID-19 has even ushered us into a new normal, there will be less contact. And you see, there's what we call the feel-good hormones, the oxytocin, the dopamine, the serotonin, the endorphins. They are the hormones that we will release when we interact, we hug, we touch. Now they're saying no touching, they're saying no hugging, they're saying the social distance. You bet me, we're in for a very, very, very huge impact of that on the minds of people, and largely on society. So I think that one of the areas where anyone could need to be smart now, if you want to position for the future, is to begin to create those therapy hubs where people can come in, sort out their psychological problem, and so they could better fit into the society, and they can better fit into their family, etc. But also, I need to quickly, what's the definition of a person with a good mental health? Number one, he feels in control of his emotion. They have a good cognitive functioning. They have a ability to have positive interaction with people around them. Okay, just to mention a few. According to WHO, mental health can be conceptualized as a state of well-being in which the individual realizes his or her own abilities, can cope with normal stress of everyday life, can work productively and fruitfully, and is ultimately able to make contribution to his or her community. So all of that packed together is part of the things that needs to be looked into by churches, by pastors, church counselors, and that's the sense of security enough to delegate, to collaborate with professionals. There are too many counselors who are not certified. Too many. I've attended two burials of my clients. What happened? They were being beaten in their marriage, and they said, God is divorce, God is divorce. So they kept beating the woman. One is a very popular story I don't want to go into. They never lived to tell the story. I'm not sentimental about that as much as my faith seems to be a bit diplomatic about that state. Once domestic violence set in, separation is the first option. Both parties can go see a psychotherapist, a therapist, and give an attempt to see their marriage will work again. So all of this kind of counsel from religious organizations have brought, a counterproductive approach to the well-being of individuals, families, and all of that. In fact, because I'm a Christian, there are two powerful scriptures I always quote to people who are very religious. One is, he said in Isaiah 61, when he says to bind up the brokenhearted, Jeremiah 31 says, I will turn their mourning into gladness, I will give them comfort and joy instead of sorrow. Elijah was depressed in the Bible. I can go on and find people who were depressed and how they came out of it. These biblical references, but the reality is, everyone needs to draw the boundary so that we don't become square pegs and round holes.
Exactly.
All right, let's see if we can take two questions because of our time.
Okay, go ahead.
So we have this one here on WhatsApp, no name, says, can religion make you depressed? And should pastors seek counseling from a therapist?
Okay, yes, pastors should seek counseling from therapists. Yes, we have products out there that we push to churches to say pastors, church counselors, imams need to be certified mental health first aid practitioners. That's what they can do. Those that want to become therapists, that's another discussion. But yes, it's important at least to be able to do proper diagnosis. When people begin to use certain kinds of words, they begin to behave in a certain way, you know that this is a time where it's no more a spiritual problem, it's a psycho-spiritual problem. Do the prayers, but do the due diligence to delegate to a certified therapist or psychotherapist that can take it. So the collaboration will now make the person be all that they were designed to be. What's the first question again? That's the second one.
Can religion make you depressed?
Can religion
make you depressed?
Yes. Like I said when I started about the dichotomy of the positive and the negative of religion. Yes. So, for example, if church should be, or religious organization should be a place where you should be vulnerable. But once your vulnerability is abused, or once you begin to feel that you are no more safe here, or someone you trusted so much, hurt you, betrayed you, and it's very funny. Betrayal is the only offense that you can commit, that can only be committed by people that belong. So you need to belong to be betrayed. Okay, so when you belong to a place where betrayal is one of the subconscious culture, it can lead into some level of mental health challenge.
Yeah.
All right, we need to go because of our time. But finally, I would like to ask, how would you advise someone to cope with a mental health challenge and still trust their religion?
Okay, so the first thing is to ensure that there's a good support system around them. The second thing is to do what we call a lifestyle challenge. The third is to pay attention to self-care. Then also the fourth is to ensure that you speak to someone who can recommend you to professional advice. And the earlier you do that, the better, because once you begin to get deeper into mental health challenges, mental illness, a lot of disorders, it becomes a lot more difficult to come out of it.
Yeah.
All right, we must thank you so much, Mr. Tunji Babajide.
Thank you, sir. My pleasure.
Thank you very much for being a part of the show. Again, we say happy birthday to you.
Thank you, Victor.
All right, then. Chinyeru Goldensi, it was a great conversation with you this morning on the show.